got this going. And yes, welcome. Let's get started. It is May 1st, 2020, and this is the end of the week COVID-19 update for the city of Burlington. And we are pleased once again to be joined by Dr. Leffler, the president and COO of UVM Medical Center. And we're going to jump right into the numbers as we have been doing for weeks. And once again, the numbers to my eye, Dr. Leffler, look very positive. We are, I think, clearly well down from the peak of a couple weeks ago, and in a period of very low new infections and hospitalizations here in Burlington. So must be a relief up there on the hill to see these numbers.
So, Mayor Weinberger, it is a great relief that we have clearly avoided the surge and what places like New York City and Boston have dealt with. And so that is really good news. And we continue to see good trends going forward. It is interesting that yesterday in the state of Vermont, there were 13 positives, and that's the first time it's been in double digits in more than a week. So that's interesting. I think on the 28th of April, there were no positives. So we'll have to dig in a little bit and see exactly what happened yesterday, whether they tested a population somewhere, where they're retesting people in one of the nursing homes. I'm not certain, but that was interesting data. That was the first time, like I said, in quite a few days, we've seen more than 3, 4, 5 positives. We are up to 50 deaths in Vermont. That's very sad, but the number has really slowed in terms of how fast it's growing. At the medical center, we continue to be in extremely good shape. Today in the hospital, we have 4 in-house COVID positive patients. We have only 1 COVID patient in our ICU, and we have only 1 patient under investigation. So strikingly lower numbers than 2 weeks ago, which is what's reflected on this graph. We have nobody on a ventilator right now, and we have still only 33 positive employees. Almost all of our employees who caught COVID and we traced them, we believe did not catch that in the hospital. That's not 100%, but the vast majority. And of the 33 positives, 28 are fully back to work and recovered. So right now we're doing the hard work of coordinating how we start offering more important care to people who have been waiting. And I've heard from lots of people in our community who have been extremely patient and doing the right thing, waiting for care that they really need. And obviously, we want to provide that care for them, safely for the staff. And so we're working through how we would do that, working with the governor of the state of Vermont, the Department of Health. And there's a bunch of pieces that fit into that. We're coming up with a clear testing plan and policy for how we would test, who needs to be tested before certain procedures. I think we have that pretty well ironed out. How we would use PPE for those populations as we start giving more care. And also we want to be careful and smart about, as we do more surgeries and stuff like that, we have to carefully monitor our PPE supply so that when COVID comes back, we do not catch ourselves in the situation we were last time, where we were really scrambling to put our PPE plan together. So we're going to be thoughtful and careful about this. We're going to figure out ways to have people come into our facilities but socially distance, have pathways for them to move through, try to keep people out of waiting rooms where they're sitting together and stuff like that. So we've been spending a lot of time. So as we're having less COVID cases, we're spending a lot of time really being thoughtful about the next phase of this pandemic. And like I said, working with the Department of Health and the governor's office so that we can, as we do start to be able to do more, we time it perfectly with the state and where the whole state of Vermont is at.
Are you, I'm sorry, Dr. Leffler, are you able to say now when these other procedures are starting, or is that still?
We're waiting for the governor to come forward and allow elective care. But what I can tell you is that when this started 6 weeks ago, we went through our list and we continued to do all emergent care. So people who needed to have heart surgery or needed to get their gallbladder out because they were sick or their appendix or whatever, that care has been happening. It's been happening very safely, by the way. We have no evidence that we've had people our patients convert to positive, getting the care they desperately needed. And every day that goes by, some care that has been deferred now becomes necessary. So we run that list pretty much on a daily basis to make sure that our doctors, our clinicians, are getting people who shouldn't wait any longer for the services they need into the hospital to get them. And we're extremely confident we can do that safely for our patients and our staff. And so we have been doing more necessary care that people just couldn't wait any longer for. The next phase of this is what I would call closer to elective care, non-essential stuff. And like I said, we are working with the governor's office every day to make sure that when that timing comes, we'll be ready to roll and get people through for the care they've been really patiently waiting for. I think it's going to be soon, Ro, but I can't give you a date.
Yep.
We're close.
Excellent. I do know, I shared with you earlier, when I was out distributing masks yesterday, I did get a constituent, a resident, mentioned how eager he was for his wife to be able to get in. And so I know there's a real desire to see these systems start going again, just like we're all chomping at the bit to see more of society opening up elsewhere. There was some pretty good news from the governor earlier today, signaling key manufacturing sectors opening up a little bit starting Monday, and then significantly more the following Monday. When I look at this slide, Dr. Leffler, I think the governor's got it right there, and that it's time to be trying this, and I think we should be, this is I sense we're really in a transition moment here, as you're kind of consistent with what you're talking about. It's not just at the hospital that we're starting to figure out how to reopen. This is something that's happening in lots of different sectors. I think we should celebrate as Vermonters the fact that we are one of the first states, I think, to be in position to responsibly start taking steps in this direction. Everyone should feel some ownership, some credit out of this graph, and the success in containing the virus in this first step and keeping it from overwhelming the hospital system. At the same time, and I think we should celebrate it, because I think we should take strength from it, confidence from it, hope from it, because the future stages are also going to be, it certainly looks like right now, they're going to be real challenges. They're going to be different challenges. We're going to have to figure out how we coexist with the threat of this virus for a significant period of time. So as we start the new month, it definitely feels to me like we're starting a new chapter here too in this epidemic.
I fully agree with your comments, and to build on what I said last week, I think the state of Vermont and all Vermonters should be proud of the work they did to mitigate the COVID-19 surge in Vermont. I think we can all be proud that we saved a lot of lives by doing that, but it came at a cost for all Vermonters, and I don't want to minimize that. We'll talk about that more in a second. In my mind, what that really did is bought us some time to be prepared for how to live with this over the next couple of years. And as we move away from mitigation to a more of a suppression strategy, I think how we do things might look will look different for some period of time going forward. And so we're spending a lot of time right now thinking about how we get care to people who need it, how we're here to support them, how we can do that safely for them. And we're fully building a model where we expect to have cases of COVID and spikes and surges, and we adjust what we do on a daily basis to manage that. And I would imagine that our cities and our state will have to do the same thing as cases crop up. We may have to be nimble and make adjustments. So we're fully building that into our planning, and we're so thankful for the time that mitigation bought us. We have better PPE supplies than we did 6 weeks ago by far. We have a better supply chain that's steady than we did 6 weeks ago. We have markedly better testing, which is expanding each day. And those are the things that we needed. And we have not many cases right now. So now we can actually be thoughtful about how we do reopen things, and then measure what happens, watch it carefully, and be ready to deal with that.
Let's talk a little bit more about testing, Dr. Leffler. Do you, I guess a question I don't think we've quite discussed directly. I just sense that in a lot of the national discussion going on, there continues to be great angst about the status of testing, and you see legislators and governors in other states calling on the federal government to do more. Here, it feels like we are in good shape. I mean, one's reluctant to say we have all the capacity we need, but feels like we're much closer to what we need here than what I'm hearing from other parts of the country. Is that the way you see it too, or what do you make of those very
I think
forceful
that,
continued
yeah,
calls elsewhere?
I think that Vermont's smallness and our ability to work together has been a huge advantage in the testing situation. So the way I can think about testing is right now, the state of Vermont coordinated can do well over 2,200 tests per day. It's probably closer to 25 or 2,600 tests per day right now. And so when you think about how you would deploy those tests, we have to have enough tests across the state to test people who show up in a doctor's office or an emergency department or somewhere and are sick and we know if they have COVID. So that's going to take some amount of those tests. Then we have to have enough tests now as we move back to doing more elective care. Some of those people for some of those cases will need to be tested. And so we have to make sure we have enough testing for that. And then whatever you had left over, you would do a surveillance program. You pick a nursing home or a jail or a school or maybe a town, and you'd start doing surveillance testing and you track that. You'd figure out how much COVID is out there that you aren't really showing, that you weren't aware of. And so as our capacity increases, we'll use some testing for those first two buckets, people who are sick, people who are getting procedures, but then the rest has to go to surveillance. And I think right now we're in a pretty good spot on that. If we start having a resurgence of COVID, more tests will go into that first bucket, and then we'll have a little less for surveillance. But I also see weekly now that our testing capacity is getting better. So I agree with you. Vermont's in a reasonably good shape on this. We don't have a test today for every Vermonter. If all 635,000 of us wanted a test today, that couldn't happen. But for the needs that we have today on May 1st, we're in good shape, and we're in much better shape than many other places.
Are those tests still happening at the hospital? With this long swab that we've heard so much about, or is the manner of testing changing as well?
So how we're testing is getting better. We're getting some shorter swabs that's a little easier on patients, and we're having some different kits. So it's all improving.
Good. Last thing, Dr. Leffler, I think you said it well, and I know you're feeling it today. This time that we have bought, as you said, it has come at a real price for many Vermonters. I know, somewhat ironically, and signaling a broader problem with how our healthcare is financed. I know that the hospital has not been spared from that. Dr. Brumstead had some news earlier today. Can you share any perspective on the announcement about the hospital's steps that you're taking, and maybe summarize for listeners who haven't seen it what the hospital is doing to try to control costs?
Yes, thank you for asking. So preparing for the COVID pandemic and the potential surge, we made what were necessary, important decisions to potentially, or to stop all elective visits, elective surgery, elective procedures, elective imaging. And that's a huge part of our business. That's a huge part of how we keep everything going here. Also, we spent significant dollars preparing for the surge. We spent time and money building new spaces and getting ready and getting equipment and PPE and ventilators. So the impact was at the end of March, we had lost over $30 million for the fiscal year of 20. And currently right now we're losing about $1.1 million every day from services that we're not providing. And when we project out to the end of the year for the UVM Medical Center, if we didn't make some significant changes in what was going on, we project to lose more than $85 million. That's $85 million in the red. And so we made the hard decision that we had to make changes right now. We couldn't wait and see what volume would come back as we started doing more elective care. We couldn't wait and see what kind of federal stimulus money might make it to us. We wanted to basically cut down how much money we were losing in a day. And so we made the hard decision to cut leaders' pay. So for our vice presidents and above across the whole UVM health network, but at UVM as well, a 10% cut in pay for the rest of the year, 5% for our directors, and we stopped employer retirement contributions for those leader groups as well through October 1st. That's a really hard thing to do because these people have been working literally around the clock preparing our hospital and our network to manage COVID patients and do it safely and care for our staff and the patients. But we felt it was important right now to take a step to start to correct our situation. We've also implemented a hiring freeze. And over the next couple of weeks, we're going to make sure that we're doing other important steps to make the gap as small as it possibly can be. I am confident that as we start providing more care, that will clearly help. And we are still working hard to make sure that the appropriate federal stimulus money that should come to us comes in our direction. But I do want people to know that overall, as tough as this is, the medical center will survive this. We'll get through this bumpy patch. We have the right people here. We have the right things in place to get it done. And we are committed to doing what's necessary to be here for people who need us.
Well, thank you for sharing that, Dr. Leffler. I'm sorry the whole UVM Medical Center community needs to go through that right now, again, at a time when you have spent the last 2 months on the front lines of this critical battle. It doesn't seem right. It seems like a sign of something wrong with the way we structure healthcare, that right when we need it most, you have to go through this kind of challenges. But it also sounds like you guys are making the tough decisions you need to make. Thank you for doing that and keeping the institution strong. We've got a lot of other topics we gotta cover here. I'm gonna let you go. Thank you for carving out this time again, and have a good weekend. Look forward to catching up with you again soon.
Thanks, everyone. Have a great weekend. Thank you.
All right, so if we could move to the next slide, we got, as we like to do on Fridays, we want to talk about the stay home order as we head into the weekend here, and what Burlingtonians can expect. This is, I know, something that, well, I'll let Chief Morrison speak first, and maybe I'll backfill some additional comments. Chief Morrison, welcome. Thank you for joining us.
You're welcome, Mr. Mayor. It sounds like I'm your girl Friday from the way you introduced this, so I'll take it. So heading into the weekend, we think it's going to be nice weather tomorrow, and that's going to tempt a lot of people to get outside as they should to recreate. I just want to really call out the difference between recreating and congregating, because they're two different things. One is allowed and one is not allowed. So the governor did open up the spigot a quarter turn, as he said he's going to today, but he did not make any changes to the previously existing rules around being outside. So we will continue to be present in the community and keep a watchful eye out for violations of the governor's executive order. We'll continue to start from a position of education and giving people information. We will also try to seek voluntary compliance with the executive order, and we will also be completely willing to issue city ordinance tickets to folks who are willfully violating the governor's executive order. So that's what folks can expect from the police department this weekend. And I think Dr. Leffler summed it up. Vermont's done an amazing job. Burlingtonians have really stepped up on this. It's going to get harder the longer we stay in this posture. So we're asking folks to continue to be mindful and to self-regulate. I think you wanted, I did want to point out from the governor's update today that he has mandated the wearing of masks on all public transit or mass transit facilities. So whether it's the facility or actually on a bus or a train or a plane, in Burlington, you have to wear a face covering over their nose and mouth anytime you're using a public transportation conveyance, including buses, trains, and ride services, and when in a mass transportation station or terminal, including airports. So that's also something we're going to be on the watch for, at bus stops, et cetera, and we'll be partnering with transportation providers to assist with that. And again, we'll be at the education phase, but very quickly moving to an enforcement phase if folks are willfully violating that part of the order.
So before we move on, Chief Morrison, thank you for making that point about the masks. It is recommended that whenever people are outside the home, they have face covering. We'll have more later in this briefing on additional efforts, additional opportunities people have if they want to get some of these durable cloth masks that the city has been producing. But I appreciate the distinction that there are some places where it's not just strongly recommended, it is actually required. And I just wanted to add on, your thanks to Burlingtonians and requests that we sustain this very disciplined posture for another weekend. It gets harder every weekend, especially as the weather gets better. I am hopeful there will be some loosening of what is required in these outdoor public spaces, public parks soon. Burlingtonians should know we are actively planning for restarting operations in parks as soon as we are able. We want to be able to move quickly when the governor does loosen the orders. And so I think we all feel that and feel that it's close, but it is not there yet. And I think the governor made the point is all of this loosening is dependent on the numbers staying good. We just heard from Dr. Leffler that there was this kind of unexpected spike yesterday. Maybe it's just an anomaly, but 13 positives yesterday. It won't, we're a small place, it doesn't take that many positives to start to, raise concerns again. So let's keep at it through this weekend and, kind of complete this job of this first phase so that we can move on to the second phase together. Chief, since we had you here, it's been an eventful week with the police department. We had one of these events we hate to have here in Burlington. We're fortunate they rarely happen. We are one of the safest cities in the country to live in, but we are not immune to gun violence. We're not immune to violence and crime. And we did have a homicide earlier in the week. I know your team has been working extremely hard to try to resolve that case. And when these things do happen, there's great urgency to bring resolution and share as much as we can, as quickly as we can with Burlingtonians about what's going on. Where are we in that process now, Chief?
Right. Well, where are we in this process? We're in the thick of it, Mr. Mayor. I mean, this is the epitome of a methodical and thorough investigation, and we're making terrific headway. We are, as we speak, our men and women are sifting through a lot of evidence, a great volume of evidence from many different sites. They're talking to a lot of witnesses and people with knowledge. As you know, we have one person in custody who is related to this incident. We're not completely prepared to explain exactly that, the involvement, but this person is connected with the homicide incident. And it was a person who was wanted on a parole violation and also was charged with federal firearms crimes. So I anticipate being able to share more information next week. I think what Burlingtonians need to know is that this was not a random incident. These are folks who were well acquainted with one another, and that we are making terrific progress on this case. I am very pleased with how things are going. And yes, a big shout out to not only to our men and women, but to our federal partners and the Vermont State Police and others who have helped us get to the point where we are.
All right, excellent, Chief. Why don't you stick around with us? There may be, if there's questions later, but we have a couple other topics we want to share before we head into the weekend. I think next up, we want to talk about big shift in topics here. We want to talk about tree planting and city trees. This is a good news story of the last couple of weeks, and one that we were concerned wasn't going to happen. We have Vijay Komai, who's our city arborist, joining us and zooming in here, and I'll let Vijay kind of share his perspective on this in a sec. But it basically I think it was yeah, 2 Fridays ago, we were sitting on top of a couple hundred trees that had been harvested out of the ground through this bare root method that we have started using in recent years, which is a great, very efficient method. It's one of the things that's allowed us to dramatically expand our tree planting program just when we need to be doing that because of the threat and the inevitable arrival that we expect of the emerald ash borer. We've been trying to expand that program. We've been using this bare root method, which is different from, instead of these big root balls on the trees, you basically just have the roots encased in this kind of gel that keeps them moist. And it works great in normal times. We hit a major problem once these trees have been harvested, in that there's an expiration date on the trees once they're in these gel packs, and it was not possible to plant the trees initially because of the stay-home order. There was a prohibition on that kind of tree planting work a couple weeks ago. Fortunately, the governor started to lift the stay-home order, alter it 2 weeks ago, and as soon as he did, VJ's team got to work. I want to let you take the story from there, VJ. How have the last couple weeks gone on this front?
We were really fortunate. We were fortunate with the weather that we've had over the last couple of weeks because it stayed cool. While everybody else was complaining about the weather, I was pretty happy to see nights in the 30s and days barely getting out of the 40s. So we were able to store the trees in the Letty maintenance building, our old maintenance building, and we darkened the windows and we kept it closed up. There's no heat in there, and with the temperatures we were having, it essentially served as a cold storage space. And as you said, these trees have a shelf life, and we were ready to go with planting them. Unfortunately, they were taken out of cold storage from the nursery they were harvested at and shipped a couple of weeks earlier than we had anticipated. So it was very weather dependent. As soon as the governor lifted his order, we had all the sites marked. These trees were ordered back in December in order to get the species and the number of trees that we needed. And then we had to commit to this order by, I think it was the first week in February. So we had no choice but to take the order. And luckily, the governor raised the restrictions on the outdoor work. We had a good plan in place, and we had a very efficient way of getting around the city, all in separate trucks. We were able to do this, as you can see by the photo below there, maintaining good social distance and keeping the public safe as well. And we started planting the trees last Wednesday, and as of today, there's about 7 or 8 trees left to put in on Monday. And we've planted about 260 trees throughout the city.
Awesome, VJ. Thank you. And thanks to the whole team for the hard work there. I mean, I know this is something we had it planned on, again, having some kind of volunteer effort to make possible. Instead, you guys all had to do it yourselves. How big is the crew that was able to get all this work done?
There was myself and 3 full-time crew members. Typically, we have a couple of seasonal employees at this time of year, but we do not have any seasonal employees yet. But it all worked out in the end. It would have been nice to have the volunteer tree planting day. We had planned about a third these on that Saturday, but we'll plan for another one. When all this is over with, this COVID-19, we will still be facing the effect of being a climate crisis. So I'm happy to see that we're still planting trees, and the feedback we got from residents around the city was very, very positive. So,
do you want to just remind people, I know some people have heard this, but I think the proactive work that you're doing, can you just describe for people how some of this work at least is focused on getting ready for the ash borer?
Yeah, the bulk of the trees that we planted this spring are being planted proactively as replacements for ash trees throughout the city in our green belts. We currently have about 1,100 ash trees in our inventory throughout the city. That includes green belts and parks and cemeteries. About 920 of those are in green belts. So it was not last fall, but the fall before, we started identifying areas in the city where the green belts are wide enough, allows for us to go in and start planting trees in between. And we're using a diversity of species. And we know emerald ash borer is going to get here eventually. There's no question about that. So our thought was, let's get a bunch of trees in the ground. Let's get them started, get a good foothold, hopefully get several years of growth out of them. And when the insect does move in and we have to start removing trees, we've already got our replacements, and we've got a wide diversity of species. So some of the areas we planted this year, if people are riding around the city or out for a walk on the south end, it was in the Southwind condos down by Oakledge Park. There was Scarf Ave and Ferguson Ave, and then in the New North End, Morrill Drive, and then the big planting was out off of Riverside Ave on Hillside and Hildred Drive. And we also planted a bunch of trees on Upper College Street on the north side from Prospect down to Willard Street, and various other trees throughout the city. We left the name tags on most of the trees because we found that residents were asking what they are. So a lot of people out walking. I would encourage them to walk these areas and check it out.
Excellent. If conditions allow, we expect another push in the fall going into the winter.
Yeah, assuming we have the money and the personnel, yeah, we're going to keep going. As of today, we have now planted replacements for almost 45% of our existing ash trees. So that's
awesome.
That's pretty good stuff proactively. Yeah.
And that's just in a couple of years of this proactive ash work, right? And that was last year, the first year that we did that?
Yes. Yeah.
Okay, great. All right, well, PJ, thank you for being here. Why don't you stick around in case there's questions. Let's keep moving, Olivia. Today's May 1st, beginning of another month. We know that means that rent and mortgage checks are very much on people's minds, and we want to give some update on where this is. There's been an enormous amount of public policy work and debate around basically how this system is going to work given the impacts of the COVID-19 emergency. There's still a lot of debate to come and uncertainty, but there are a few things, updates that we want to make sure people are aware of. If we could keep going, Olivia, I think we want to point out there's a bill that passed the Vermont House this morning that seems to all have support, I believe, of the other branches of government, and that is likely to ultimately be passed, that I support. And here's what this bill would do. It would further extend the freeze on evictions that is in place now. I think the impact in Chittenden County would be pretty modest because it's really to make sure, as I understand it, that the protections that are in place in Chittenden County are statewide protections, because Judge Tor, was such a leader on this probably a month ago now when she put in place the order that essentially froze all evictions and foreclosures. The way this bill reads, it says this freeze will remain in place for 30 days after the statewide emergency is lifted, the governor's declaration of an emergency. I want to be clear, this is a freeze on evictions, and legislators were really clear about this too. This is not intended to be a vacation from rent. It is intended to be a freeze on evictions, and sort of recognizing that it just would be a great injustice for anyone to be kicked out of their home, to lose their home right now in the middle of a stay-at-home order. And that's what this this bill will ensure is that that doesn't happen. Let's keep going, Olivia, if we can get the other bullets out there. We know that the idea behind this is that there have been numerous relief efforts. I mean, to the degree all these things are coordinated, and there is, there's this actions happening at all levels of government quickly. I think it's a real challenge to coordinate it, but the rental market is related to mortgages and borrowers, and what this bill recognizes is that that system will move forward again after the stay-home emergency is lifted, and hopefully most people will be able to keep finding a way to fulfill their commitments with the various relief efforts and with the restarting of the economy, and through working out whatever your situation is with the property owner that, or if you're a mortgage holder with the bank, through those kind of direct conversations. If you need help in those direct conversations, one of the things and services that we can provide at the Resource and Recovery Center is advice and some referrals and other resources to help with those conversations if you contact us at the Burlington Resource and Recovery Center. We know and anticipate that it's not going to be that straightforward, that there are almost certainly going to be gaps and problems in this system going forward, and all levels of government are actively looking at that and trying to figure out how best we can provide some additional relief effort to households that have been particularly hard hit by this and that are not able to access relief through these other ways that keeps them safely in their homes and stably in their homes. And that all levels of the government certainly includes the city team. We've got a working group very focused on this and focused on what the state is doing, and we expect there will be announcements about these relief efforts in the weeks ahead. A related action, we think of it as being part of this, is what the city is doing with respect to allowing property taxpayers to defer payments without penalty or cost. We've already announced that that's what our policy is with the June payment. If you've been impacted, if you're a property owner and you've been impacted by the emergency, going through a simple process, you will be able to postpone those taxes without penalty or interest until August. We will have an application for that effort up by May 12th, and the reason it's not going to be up sooner is we want to avoid confusion, and we are looking actively at whether there's anything we can do to expand that program over that kind of initial benefit that has already been approved by the council. We're looking at whether that we can give people additional time or put in place some kind of payment plan, and we expect to bring a plan on this to the council at their May 11th meeting, their next meeting, and then we'll have an application up May 12th, which is a full month before the property tax payments are due. Excuse me. Why does this, I know some people hear this, it may not sound, how does this help renters? Well, this benefit and whatever new benefit we're able to provide would only be offered to property owners who are willing to pass on that benefit to their commercial and residential tenants. And so this is intended specifically to be a further tool in helping this whole system recover and ensure that individuals and small businesses are not kicked out of spaces that they are leasing. Let's keep going, Olivia. Also, since it's May 1st, it means it's May Day. May Day is an International Workers' Day that really rose out of the labor movement of the 19th century, and is a time for us to reflect and honor all of the progress that labor movement and our current labor movement continues to earn. And as we say this just a few minutes ago, there was a protest here on Main Street marking May Day. here in the city of Burlington, this is particularly on our mind given the heroic work that essential workers have done over the last couple of months, putting themselves at risk to get the work done for society that is necessary to keep us going and keep us safe through this pandemic. And I did just want to, we know here that words matter, actions matter even more. And throughout this epidemic, the city has worked hard to support our essential workers here, city workers, but more broadly, essential workers in Burlington through a variety of actions, a list of actions. And I did just want to recap them here on May Day. First of all, in the early days of this epidemic, we put in place, and we're very public about, a robust emergency leave policy, and we try to hold that up for other organizations to consider with respect to how they should treat their workers through this epidemic. We have been providing masks and other PPE, of course, to our first responders, and we have certainly given masks to now all city workers that are continuing to have essential work. We have created an employee mask policy, and I think maybe not totally clear on the slide, the mask effort that we have been pursuing is for all essential workers in Burlington, not just city workers, but any essential worker in the city. And at this point, we have distributed those masks to dozens and dozens of organizations, and we believe that essentially all essential workers who want these durable, high-quality masks have them. If there is any out there, city Burlington workers that don't have those masks yet and you need them, we continue to generate these, fabricate these, and we're happy to supply more. Get in touch with the Recovery Center if you are looking for more. We did publish a livable wage report, even in the middle of this emergency. A lot of typical tasks have shut down over the last couple months, but we thought it was important to get the livable wage policy annual report out, and it shows another year of increased compliance with the city's livable wage ordinance and increased monitoring and enforcement efforts on the part of the city to make sure that very forward-looking ordinance is being followed. And then finally, from the early days of this, sometimes the duct tape doesn't completely hold up. From the early days of this emergency, we have been covering, as a self-insured employer, we've been covering all the healthcare costs of our employees and their families that are covered by the city policy, and we have been encouraging other self-insurers to do the same. I think that's our recap for May Day. And speaking of those masks, we are now beyond just providing masks for essential employees. We think we've got the essential employees covered. Again, if we missed anyone, let us know. We are now opened up this masking effort, this community masking effort that so many, really dozens of individuals are involved with in the fabrication of these masks with city supplied materials. We had a couple very successful distributions this week at grocery stores of the masks, and there seems to be real interest in them at the grocery store. So we're going to continue with this strategy. You can see there on the screen the schedule for next week when people can pick up these masks. You can see most of them are early morning hours. That is when these grocery stores have specifically kind of invited people who are older or have underlying health conditions to shop during those periods. So we want to make the masks available at those times as well. But I do want to be clear, you shouldn't feel that you can only come get a mask in those periods if you if you are from one of these vulnerable groups. This is now open to all Burlingtonians. Come on by. We have hundreds of these masks, and we're working to get them out as quickly as we can, particularly with the sense that the stay home order is starting to lift, and that a couple weeks from now, we may be in a different posture. It's going to be important in this next phase for everybody to have a high quality mask and to use it. And we're hoping to help make that easier with this ongoing effort. I think we have one more slide, which is the fun at home resource of the day. And again, this one is provided by Burlington City Arts. This is a watch party that is taking place in just over an hour. So you can go almost straight there. And this is part of the BCA Home Studio effort, which is this initiative that BCA has stood up during the pandemic to get as much of its content online, available, virtual, able to be enjoyed by Burlingtonians and the wider community while we are in this stay home posture. And there is the link and details. You can find it by going straight to the BCA webpage as well. And if you are there, we encourage you, if you are in position to do this, to consider a donation to the Artist Relief Fund, another BCA initiative during this emergency that is getting much needed resources into the hands of artists who are another group that has been hit hard by this emergency so far. I think that's it, Olivia, right?
Yes, and we do have a couple of questions.
Okay, let's get right to them because I am going to have to go soon. So let's do it.
Great. First question is from Ross from NBC5. His question is, activists across the country, including here in Burlington, are encouraging a renter strike. What is your response to the push for a renter strike in the city?
I certainly understand the sentiment behind that and the concern, and it's a concern I have shared throughout that clearly this is a public health emergency that has dramatically impacted people's incomes. It's dramatically impacted people's ability to pay rent and for other essentials. And so I understand the sentiment behind saying the first priorities should be food and these other basic essentials. I think clearly what is happening here at throughout the country is an effort to recognize the challenging situation that so many members of our community are in, and to get people help. And we are I'm going to continue to advocate for this bill that we talked about earlier. There should be no evictions during this public health emergency. And we know that people need help to make these payments. That is why, we said what we did. There will be further relief efforts as needed. I do think it's important that people understand that these eviction moratoriums are not vacations from rent, as was said before. There is going to, people still have commitments. We're going to do everything we can to craft relief efforts that get the people the help they need to make good on those commitments. But people should recognize that that those commitments remain in place, and that's what that was the nature of my comments before, was to address that.
The other question was more of a fact-based question, so I think I will follow up on that one directly offline. And those are the questions that we have from members of the media for today. Great.
Thank you, Olivia. Thank you, everyone, for tuning in. We hope you have a great weekend, and we don't quite have a plan for next week yet. I'm sure we will have briefings. We'll be in touch on Monday about the schedule for next week, and encourage everyone to stay safe and enjoy the improving weather, but please try to do so in a way that is, again, as we talked with Chief Morrison earlier, still consistent with the orders that remain in place. Thank you, everyone. We'll see you again soon.